My father testified before Congress, and Dan Burton actually asked him in the middle of his testimony that he said, "I heard you're trying to get into the VSD database. Are you in yet?" And my father replied, "No," and they seemed to be putting us through endless hurdles. If you watch the videotape, Dan Burton actually pointed out into the audience to somebody and said, "I want to see you after this hearing about that." And we think what he was talking to was one of the CDC representatives that was there. And so on December 31st, 2002, we got a letter back from CDC stating that they had approved our proposals. You might think, well, we got right into VSD. That's not what happened. We had to contact each of the health maintenance organizations that participate in VSD. For those who aren't familiar, Vaccine Safety Data Link has very different than the data than the VAERS database. VAERS involves reporting of vaccine-suspected adverse events. The VSD contains the complete medical records on patients, and it has as another file what vaccines they got. So not only did we want to analyze new data for our own studies in the VSD, we wanted to reanalyze their data from published studies. And we got back very interesting responses from the CDC to our requests. They admitted, just as an example, the safety of neonatal hepatitis B vaccine. That's that birth dose of hepatitis B that everybody's so concerned about. Turns out that first CDC said that they didn't have the data, so we said, I mean, that's unacceptable. So
finally they said, well, it's actually been lost. All the patient data has been lost. So the United States, so we, by the way, we suggested at that point that they withdraw that study because there was no data to look at, and the whole U.S. policy on this issue, this controversial issue of giving children shots at birth, is based on a study that they have no data on, and they've lost the data. I think they thought they were going to get the IOM to say that people like us shouldn't be looking at the VSD database. And so this one totally trumps the other one. And one day after this came out, exactly one day, this came out on a Thursday in February, one day after that, there was a meeting to which Julie Gerberding was invited. She's the head of CDC. And at that meeting, the entire vaccine immunization program was fired.
But unfortunately for our VSD experience, even with all of this amazing restructuring going on, we still have not been able to see the full VSD database because there are lingering effects of what the National Immunization Program did. And I got so upset when I was there. We're paying $1,000 a day to be here. Dale Krenick again flew in all the way from Texas, and you're not allowing us to see any of the data. And I said that you'd promised to Congressman Weldon and his staff on the phone that we would have open access to this. And Congressman Weldon's staff said, you know, they'd come down. We were only about 35, 40 minutes away from the Capitol in Hyattsville. And CDC responded back by saying that they weren't going to be allowed into the building.
They would not allow a sitting U.S. House of Representative doctor who's on the Oversight Committee, whose job it is to watch this, would not be allowed in the building.
What it looks like is a contrived effort on the part of CDC that they went into our computer programs, they went into our logs, saw that we were seeing the effect, and they terminated those data sets.
And incidentally, those logs, the agreement was, although they could keep all the logs and every keystroke we made, they could only look at them for patient confidentiality. They could not look at how we analyzed it, nor could they reanalyze it. But obviously, they didn't obey their own rules.